The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning, everyone, and welcome to Pain Free Today. I'm your host, Denis Thompson, and for those of you who were at the FCA convention over the weekend, it was a privilege and a pleasure meeting you. As we said last week, we were going to be at the FCA convention at the Peabody Hotel. And there were literally hundreds and actually thousands of doctors there, and many of them we had an opportunity to meet with and meet in our VIP suite. So it was a very, very good time. And what I'd like to do with you listeners today is kind of bring you up to date if this is the first time you've listened to the show. Really what the show is all about is introducing you to a therapy that we call neurotherapy. And people always ask me, what is the difference between neurotherapy and other types of therapy, such as physical therapy or occupational therapy? And it's a very simple answer, really, but it becomes very complex in nature. So let's get right down to the nuts and bolts of what neurotherapy is. Neurotherapy is a therapy that is based on a very simple premise. And that premise is that everything in your body is controlled by a central nervous system. And that is your software that drives everything in your body. Just think of it in computer terms. The nervous system equals software, which drives everything in your body. And if that, in fact, is the case, then doesn't it make sense that we should have a therapy designed to work on the software just as though we would have in with a computer? You have computer software, which requires attention, and you also have hardware, which sometimes requires attention. However, in medicine, we traditionally work on the hardware. We don't work on the software. So what neurotherapy is a therapeutic system, and it is a system, and it's designed to work on the nervous system. So to give you an idea how that would work is the first step of neurotherapy for the providers and for potential patients listening is we have to find out is your nervous system working or not. Now, the way we do that is a very simple test that we created, which is what we call imbalance, and all we're looking for, does your nervous system send the appropriate signal to your muscles to allow your muscles to act as shock absorbers? That's as simple as it gets. Because if your muscles can't act as shock absorbers, the shock is going to be going to some place that it's not supposed to be going to. So if you're out there listening and you have pain in a joint, if you have torn tendon, torn ligament, if you have a broken bone, I can guarantee you that the force which is supposed to be going into the muscle is going into that damaged tissue. And the way I know that is because you can't have a torn tendon or torn ligament. You cannot have joint problems if the muscles are doing what they're supposed to do, unless you exceed the muscle's ability to absorb force, which would be an auto accident or a very, very severe accident of some kind. But generally speaking, that is not the case, including athletics. So the first thing that we have to do in our system, which is a three-part system that we call neurotherapy, and it's all underneath this big umbrella called the ARP Wave System, is we have to find out, is your nervous system doing what it's supposed to do? Now, many of the practitioners listening, and I know there'll be quite a few from the show, many of you listening are familiar with an EMG. And for those of you who are not, an EMG measures the electrical impulses going from point A to point B. That's all it measures. So we determine if your nerve are sending the right signal and you have no interruption in the signal. What that EMG does not tell you is if that signal is strong enough to fire a muscle to allow the antagonist muscle to absorb force. So in other words, if that signal isn't strong enough, your shocks don't work. And if your shocks don't work, the shock is going to go someplace, again, it's not supposed to go. So you're not supposed to have force going into tendons, ligaments, bones. You're just not supposed to have that happen. So if it's happening, you're going to have pain, and we know the muscle isn't doing what it's supposed to do. So with that in mind, we test you. And for those of you who were at the show, and we had many patients at the show, we had many doctors at the show, and we did probably 60, 70 treatments while we were there, you saw every single treatment begin with the very same thing, and that is that we tested to see, is the nervous system sending the right signal? And the way that we do that is we have you lay down on your back, and we raise your leg up, and we push down lightly on your leg, and you resist. If there's any give at all, you're not absorbing force, because if you can't absorb just the slightest amount of force pushing down on you, then you're certainly not firing that muscle adequately enough to absorb the force of you even walking around. So sooner or later, it's going to overshadow everything, and you're going to have a problem. So the first thing that we do is we test each of the muscles to determine, are they shock absorbers or not? If they're not, then we have to go to the second step of step one, and that is we have to turn those muscles back on. Think of it this way. If your computer software does not work, your computer does not work. Now, everybody understands that analogy. And when I use that analogy, we have never thought about it as a human body analogy. But the human body analogy is if your software cannot tell your hardware what to do, your hardware is going to have a problem, just like in a computer. So as we think of things in very simplistic analytical terms, let's just think of our body as a computer. It's driven by software called the nervous system, and the nervous system drives the hardware, which are called the muscles. And if we don't have that connection, we're going to have a problem. Unfortunately, there's no other therapy which addresses that software in soft tissue injuries, post-surgical care, pre-surgical intervention. None of those things are addressed on a neurological level. As a matter of fact, every single test that we have known to medicine today, with the possible exception of an EMG, tells you exactly where the problem ended. So if you do an MRI, you do an X-ray, you do an ultrasound, you do any kind of testing whatsoever, it tells you where the problem ended. There is no test telling you where the problem came from. In other words, where's the signal coming from? Where's that direct line of communication coming from, causing the feeling of pain, or causing the restricted range of motion, or causing the numbness or the tingling? We can't track that signal back. So in step one, we have to make sure that the switches are on, the software is working. Because if it isn't, then in step two, we're not going to be all that successful. Because in step two, we diagnose through the use of a highly proprietary tool. We now give your doctor the ability to identify exactly where the signal is coming from that is causing the pain in the location that you feel it. As an example, if you have an ankle sprain and it hurts like sin in your ankle, that is not where the signal is coming from that's causing that pain in your ankle. The signal is coming from someplace completely different. And until you find out where that signal is coming from, because that signal is doing two things. Number one, it's creating pain, and number two, it's creating a neural pattern of movement that we call a compensation pattern. Until you find that signal, you can't break either one of those. You can't stop the pain quickly, and you can't stop the bad movement pattern quickly. So the first thing we do is the system working? Is it sending the right signal? The second thing we do is we identify where is the origin of the signal coming from, which is causing the symptoms. And we do that with our own proprietary tools and technology, and we scan the body. So let's say, again, you have an ankle sprain, and we put an electrode on your ankle, and we put another electrode maybe on the middle of your lower back, as many of you saw, because we saw a lot of ankle sprains in Orlando. So as we turn the power up, we turn it up to a designated level, and then we ask you what you feel on a scale of 1 to 10. And it will never be pain. It will just be a kind of a pins and needles type of sensation. And 10 is really high, and 1 is very low. So you say, I feel like a 3 or a 4. So now we start dragging that electrode around, and what we're looking for is for the providers listening, we're looking for sodium-potassium leakage. Wherever there's sodium-potassium leakage or scar tissue, there's a cellular miscommunication. Well, since the cells communicate electrically, and since they communicate through the nervous system, if there's an electrical short, they're not going to be able to communicate. So right away, we're going to look for the greatest amount of miscommunication. When we find that, we call that point A, or our first hotspot. And it's going to be nowhere near where you, the patient, or you, the doctor, know it hurts. It's just not going to be there. Where it hurts, and where the doctor's been taught that the problem is not where the problem is coming from. That creates a problem as far as speeding up the recovery from injury. So now we identify point A. We identify the neurological origin of that signal. Well, every signal has a beginning and an end. So now we have to find the end of that signal. And typically it is, again, not going to be where you feel the pain. So we have to find the beginning of the signal and the end of the signal before we can make a change in the symptoms. Just that simple. And what I mean by a change is I'm talking about an instant change. I'm not talking about a change that takes 6 weeks to get. I'm talking about a change that takes 6 minutes to get. This is, again, all about accelerated recovery and performance. It's all about speeding up the process, drastically speeding up the process. So in step 2, we use a very, very unique proprietary tool and technique, and we train the doctors on how to do this, and it will identify exactly where the beginning and the ending of the signal is coming from that is causing the symptom of pain where you feel it. It's causing restricted motion where you are restricted in motion. It's causing the tingling, the burning, whatever sensation you're feeling. That signal has to be coming from someplace. So we identify the signal, and then with that same proprietary tool, we now begin the treatment process, which is the second phase of our program. And in that treatment process, what we're doing is we're identifying the beginning and the end of the signal. We're identifying your movement pattern, and then we're going to treat that and neurologically retrain you on moving more efficiently. I hear our sounder right now, and so listen very carefully to how you can try the ARP Wave System neurotherapy in your doctor's office or in one of our providers' offices at absolutely no cost or obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
We are back, and you are listening to Pain Free Today. I'm your host, Denis Thompson, and we were talking about the ARP Wave System neurotherapy. And we got to step 2 in the therapy, and that is finding the beginning and the end of the signal, which is causing the physiological symptom of pain, restricted range of motion, or some other sensation. And then we talked about utilizing our proprietary tool and moving it from the diagnostic stage directly into the treatment stage. Now, what we're treating the origin of the signal, which is causing the problem, which is a neurological signal, and we're sending blood to the damaged tissue. All the time, the most important thing we're doing is changing your movement pattern. Because keep in mind, if you have pain anywhere, you're going to move away from that pain. That's just a natural, hardwired pattern that you have as a human being. So if it hurts on the right, you're going to move to the left. And the minute you move to the left, your movement pattern changes. And that movement pattern becomes a neural pattern. It doesn't become a physical pattern. It becomes a neural pattern, and you have absolutely zero control over it because it now is consistently reestablished by the way you move. And you move that way because it hurts to move any other way. So what we do in the treatment is we begin to neurologically re-educate you on how to move efficiently at different stimuli. So we will watch you move with no stimulus at all. We'll draw your attention to things that you've never even dreamed that you were doing. And we'll get into some cases that we ran into at FCA in later segments of the show, and I think you'll get an idea what I'm talking about. But you don't know you're moving the way you're moving, and I'm sure some people have told you, did you know you were limping? Oh no, I'm not limping. Did you know that you're moving your head to the left more than you are to the right? No, I didn't know that, because you don't know it because it becomes a neural pattern. It's normal for you. It's not normal for the rest of us to see it, but it's normal for you. So what we have to do is we have to break that pattern, and that is a pure, simple neurological pattern. You always hear all the time about muscle memory. There is no such thing as muscle memory. That's a very, very poor choice of words. What it should be is a neural pattern, because that's exactly what it is. You repeat over and over and over and over again a specific task, and you get really, really good at doing that task. That is a neural pattern. It has nothing to do with muscle memory. It has to do with the nervous system creating that pattern and allowing you to repeat it, repeat. There's an age-old expression: the more you do something, the more it becomes you. And in athletics knows that is very, very true. The more efficiently you are at doing something, you become more efficient at doing that something. Well, that could be either good or bad. In the case of therapy, it's bad because you're changing your pattern. If you want to know how to move, and if you have a 2 or a 3-year-old at home, look at them move. That's how you're supposed to be moving. And if you're not moving like that, you need to see us. And you need to see one of our providers, because that eventually is going to cause a major, major problem. So the first thing that we do is, when we work on the signal where the pain is coming from, guess what happens to the pain? It goes away. I mean, it's just that simple, because we're getting rid of the signal. When we're working on the signal that's causing restricted range of motion, what do you think happens to restricted range of motion? It goes away. And I'm talking about in seconds, not days, months, or years. I'm talking about seconds, because the signal is changing. So the reason that this is such a very valuable tool for every doctor who's listening is because it adds a completely different complexion to the therapy that we're presently doing. If you're a medical doctor, if you're a chiropractor, if you're a surgeon, you are working on where the problem ended up. You are not, and up until now, have not had a tool to find out where it's coming from. Now you do. And now you have a therapy that can neurologically reestablish a new pattern of movement, which breaks down the old pattern of compensation. And if we break down that old compensation pattern, we've broken that neural pattern, which says there's a problem. So if you don't think that works, just real simple. If you're in pain and you're a patient out there listening to this, and you have extreme pain in your shoulder, you've been diagnosed with adhesive capsulitis, and you cannot raise your arm over a certain level, say 30, 40 degrees, without extreme pain, and you go out and get a cortisone shot, I guarantee you're not going to go over that 40, 50 degrees, because your brain knows if you do, it's going to hurt. So you don't do it. But you have more comfort during the day. Why? Because you've hidden that problem. Doesn't it make sense just to get rid of the problem instead of hiding it? Well, that's really what neurotherapy does. It addresses the origin of the problem, not the end of the problem. So at FCA, as an example, we had an individual come in with adhesive capsulitis, couldn't raise their arm above 45 degrees, certainly couldn't raise it in a front delt raise, couldn't pull the arm back, and basically what adhesive capsulitis is, for those who are not familiar with that term, it means a frozen shoulder. It means that every time you move beyond a certain point, it's going to send pain signals to you that are extremely intense. So if you have pain doing something, and it's very intense pain, are you going to do it? The answer to that question, obviously, is no. So the first thing that we did with this individual, and many of the doctors saw this, is we tested to see if the nervous system was sending the right signal to the muscle to do what it was supposed to do. And in every single time we tested, every single person we tested, and we did like 60 or 70, like I said, every single person we tested that had symptoms failed the test. And when you fail the test, that simply tells us that we've got to turn that switch back on. So you all saw us turn that switch back on. I mean, many of the doctors, we had sometimes, 30, 40 doctors around. You see us turn that switch on. And the way we turn that switch on is we basically send a signal directly into the body, overriding the other signal that the brain is sending in, and we tell the muscle approximately 120,000 times in roughly 3 minutes' time that it's working correctly. And once we've kind of jump-started the muscle, so to speak, it does what it's supposed to do for a short period of time to where we can actually facilitate a change. So in this case with adhesive capsulitis, this patient was certain that we could not move their arm any higher than where it was when they came in without pain. And this is a doctor, chiropractor, in Florida. And so it took about 3.5 minutes, and we had his arm above his head. Now, it's not magic. It's not voodoo. It's not anything but pure, simple science. If you release the tension on a muscle, the muscle will do what it's supposed to do. And if you don't believe that to be true, I'll give you a very simple test listening to this radio station right now. Just grab a hold of your arm and pull it up into a curl. and curl your arm as tight as you can until your bicep starts to cramp. And when your bicep starts to cramp, keep pushing on that bicep. And it's going to sooner or later go from a cramp to extreme discomfort. The way to get out of that extreme discomfort is simply elongate the opposite muscle, which means straighten out your arm. And the second you straighten out your arm, you have no more pain in your bicep. That is exactly what we do. The problem is you, the patient, and you, the doctor, can't do it on your own because that is a neuro signal. When you are hurt, it's like you're contracting your bicep as tight as you can. And no amount of therapy, no amount of massage, no amount of stimulus of any kind is going to quickly, and I mean quickly, get you out of that position because it is a neuro signal, not a physical contraction as we perceive it to be. It is a contraction, but that's not what caused the contraction. What caused the contraction is a signal that says, I need to protect you. And when I need to protect you, that muscle is going to contract very hard. Now, again, if you don't believe that's true, walk down the middle of the night, walk up behind somebody in the middle of the night and touch their shoulder and see if they relax or they instantly contract to protect themselves. The answer is very simple. They're going to instantly contract. So manifest that the minute you get hurt, the minute you have any kind of trauma, your body is immediately sending that same signal to your muscle to concentrically contract. So therefore, if you're already in a contracted state and you start pulling on that contraction, you're pulling against a signal that says, I need to be here. So you're not going to be that successful quickly. You're going to be successful long term because long term you're going to be able to break it. It might take 3, 4, 5 sessions to break that spasm. But how cool would it be if you could do that in a 16th of a second? Just like you did with your arm. You just extended your arm and boom, you had no more pain in your bicep. That is what neurotherapy is capable of doing by simply stimulating the signal where it's coming from and changing the signal, allowing where it needs to go. To take the tension off. The minute you take the tension off, just like we had you take the tension off your biceps, you don't have pain anymore. Just that simple. So when the doctor's arm is above his head, he has a very difficult time understanding what happened. He said, I've been practicing for years and years and years. Every one of these cases I refer to a surgeon. And every single one of them have impingement surgery. And how is it possible that you could do that in as little as 5 minutes? It's real simple. Everybody else is working on the hardware. Nobody's working on the software. You now have the opportunity to work on the software. So if you're a doctor listening to this, we have literally hundreds and hundreds of patients that are looking to try the ARP Wave System, neurotherapy. Get in touch with us. Listen carefully to how you can become one of our providers.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson, and in the first couple of segments here, we've been talking about the ARP Wave System neurotherapy. And what I'd like to do now is tell you about a couple of very interesting cases. Well, like I said, we treated well in excess of 60 people, so we had some extraordinarily interesting cases, and many cases that would traditionally not go and be seen by the doctors that were at the show. For the simple reason is they just had been referred to specialists because they were really off-the-wall type of cases. So let's talk about, we're not going to use anybody's name, and we're not talking about how to treat somebody as far as this is not medical information. I'm not a doctor. I'm just here to tell you that how we were able to show how the ARP Wave System neurotherapy could help, and every person that we treated was a doctor, so they were extraordinarily interested to find out. So we had a young individual come in, and this individual was walking with an extreme, and I mean extreme, compensation pattern. Could not bend his leg to walk, was throwing his legs out. One foot was going out to the left, the other foot was going out to the right. And he was, if you can picture that, it was kind of looked like the Tin Man walking in his suit. And so I asked the young man who came up to me, and I asked him, I said, wait, what level of pain are you in? You must be in tremendous pain. He said, no, I'm not in any pain at all. So I said, well, why are you walking the way you're walking? He said, what do you mean? I said, well, why are you walking the way you're walking? If you're not in pain, why are you limping? Why are you throwing your legs around? And he said, well, I didn't know I was. And that absolutely flabbergasted me. So I then asked him a question. I said, well, why are you here? We're basically treating doctors in pain. And he said, well, when I walk up and down the stairs, I have this extreme pain that shoots into my knee. And I said, really? Is that the only time? And he said, well, yeah, pretty much. I said, well, tell me what happened. Well, I was out riding on my bicycle, and I fell off my bicycle, about a year and a half ago. And I said, well, what happened? And he said, well, I landed on my hip, and, I broke my leg, and they had to put a pin in my leg. And I said, okay. I said, well, were you wearing a helmet? And he said, well, no. And I said, well, did you hit your head? And he said, no. Now, if any of you have ever ridden a bicycle and you land on the side of your body that is strong enough to break your leg, unless you're Superman, you're going to hit your head because there's nothing holding you back from hitting your head. So I said, well, because he was having a hard time articulating some of this, and I said, well, have you ever been diagnosed for a concussion? And he said, well, no. Well, why would I be diagnosed for a concussion? I said, well, just a question. So the first thing we did is we put him through the step one of the neuro system, and I tested his muscles because the muscles are the outward expression of the nervous system. And he failed every single test that I gave him. And I tried to put him back in balance and couldn't do it. Probably one of the very first patients I've ever seen in my entire life, and I've treated thousands and thousands, and our system has treated well in excess of 75,000 patients that couldn't get back in balance. And so there had to be a reason he couldn't get back in balance. So then I had him stand up, and I got about 65% of his body back in balance. But when I say couldn't get it back in balance, I couldn't get 100% back in balance. So I had him stand up. I said, just for curious sake, I'm going to ask you to do me a favor. And he said, what's that? I said, I'm going to have you count to 10 as fast as you can, and I'm going to time how long it takes you to count to 10. So he counted to 10, and he made 4 mistakes. Counting to 10 took him 35 seconds to do it. His eyes were darting all over the road. And I said, you've not been diagnosed with a concussion, because that's the first concussion test that we give to everybody. And he said, no. So here's what was going on. His brain was not capable of sending the right signal at any time to his muscles to do what they were supposed to do. So he said, he has this knee pain. And I said, all right, fine. So we went to step 2 of the system, and we began to scan his body to find out where the signal was coming from that was causing the pain in his knee. And he said it was extreme only when he was walking up and down the stairs. So I asked him, how do you walk up and down the stairs? Well, he walked up and down the stairs the same way as he walked in. He looked like the Tin Man. And so if you could figure the Tin Man, or put yourself on, a set of armor, metal armor, start at the bottom of the staircase and try to walk up the top of the staircase, you'll understand how this guy was walking up and down the stairs. And is it any wonder that you might have a problem? So I said to him, okay, I got it. Now, can you bend your knee? Well, yeah, I am bending my knee. He, honest to God, did not realize that he was not bending his knee. When I got him to bend his knee, after finding where the hot spots were and where the beginning signal was and the ending signal was, when I got him to do that, he could bend his knee. But he could only bend his knee if I bent it for him, because he had no earthly idea how to bend his knee. Not one single clue on how to bend his knee. And when he started bending his knee, and I know this sounds absolutely bizarre at best, but this was a very unusual case. When he began to bend his knee, here's what he said. I had him sitting in a chair, and he was marching, sitting in a chair. He said, that feels effortless. He said, every time I move around, it feels like I'm pulling myself through quicksand. But this feels effortless. I said, yeah, it's supposed to feel effortless because this is how you're supposed to move. He said, and I'm not moving that way, am I? And I said, no, but the problem is you think you are. And that is a huge, huge problem. So in the process of getting him to move efficiently, I explained to him that you're going to be able to do this while we do the treatment. And when I have you do the movement in the therapy, you'll be able to do this. But within about an hour and a half from now, you're going to go right back to your old habit, because that is your old habit, and that is a neural pattern. And no amount of physical therapy, no amount of occupational therapy, no amount of therapy of any kind other than a neurological re-education program is going to change that. So after we had him move, I then had him step up and step down as though he was going to be stepping up and down stairs. Only this time I was having him bend his knee, and he had absolutely zero pain in his knee. Now, the reason he had no pain in his knee is because he was using the muscles to act as shock absorbers, and we had transferred the force out of his knee into his muscle where it should have been going all along, but his brain wasn't capable of sending the signal to do that task. That is neurotherapy at its highest level. After I did that, I then had him count to 10 again. He counted to 10 in 10 seconds and made no mistakes. Why? Because we stimulated the nervous system. We gave him a movement pattern that broke his old movement pattern, and now he could cognitively send that signal. But again, it's going to be a very long time, 20 sessions, before he's able to move efficiently, and he's taking over. His brain is being taken over by the technology, our proprietary technology, until his brain picks up on the fact that he can do it. So that is a very, very extreme case of how neurotherapy can help a concussion. We had another woman who was a brilliant doctor, absolutely brilliant doctor. And she's been fighting this battle for years, and I felt so sorry for her. She had a metal pin object hit her right in the middle of the top of the head. And from the minute that happened, and this, as I said, this is a brilliant woman and a brilliant doctor. When that happened, her life changed instantly. She could no longer remember things. And keep in mind, this is a brilliant woman. She couldn't remember things. She would have short-term memory losses, long-term memory losses. She'd have lapses, and she could look at something. She could read it. 5 minutes later, it's like she never read it before. So she went to a myriad of doctors, and keep in mind, she is a doctor herself. She went to a myriad of doctors, and not one of them, and I mean not one of them. First off, they diagnosed her a variety of different ways. Migraine headaches because she had headaches. She had all sorts of these other symptoms. Until one day she met a neurologist in Atlanta, and the neurologist asked her to write down every symptom that she had that she could remember. And she wrote all the symptoms down that she could remember. Now, keep in mind, this is 4 years after the injury, after seeing multiple types of doctors. So this neurologist asked her to write down absolutely everything that she could remember that she couldn't do the way she used to do prior to the injury. And he brought her into the office, and they sat down. He opened up a neurology book, and she was an absolute textbook case of post-concussion syndrome. And then they began putting her at a computer for anywhere from 1 to 2 hours, and she would sit in front of the computer, and she played video games and, kind of mind games to stimulate her brain. And it did absolutely no good. And so now we're 2 years into it further. So now we're 6 years into it. And now we're dealing with the same circumstance. So she comes in to us and she says, I'd like to, she deals with a lot of chronic pain cases and things of that nature. And so she was very, very interested to what we were doing. And she saw me treat a number of patients. And so she asked me to basically treat her with the doctor there, and I said, fine. So we put her through the system. We put her through step 1 of the system, and she was out of balance. We put her back in balance. Step 2, we diagnosed where the hot spots were, where the beginning signal and the end signal was, and then we began to do a series of tests. And I asked her to count to 100 as fast as she could. And she counted to 100 as fast as she could, and it took 1 minute and 45 seconds, and she made 7 mistakes. And so obviously that told me that she still was having a very challenging time cognitively. And so then we began the treatment. Treatment lasted 15 minutes. She was 3 minutes active in what we call active mode. And when she was done, I gave her the same test again, count to 100 as fast as you can. She counted to 100 in 35 seconds, and she had absolutely 0 mistakes, and she sounded like a machine when she was counting. That's the first time, she said, that she felt clear-headed for 6 years. That is what neurotherapy can do for a concussion. When we come back, we'll talk about another case that we ran into at FCA. But if you're listening to this and would like to try this at absolutely no cost, no obligation, so you can see what I'm saying can possibly help you or not, because the only way you're ever going to know is try it, is listen carefully to this next message.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Dennis Thompson. We were talking about a couple of concussion cases that we ran into at the FCA, which is the Florida Chiropractic Association meeting in Orlando over the weekend. One of the other things that we ran into was another very, very unusual case. This woman, I felt so sorry for her, a doctor who's lost almost everything. She was afflicted with Guillain-Barré, which is a very debilitating neurological disease, about 4.5 years ago. And she now lives in extreme pain and has to have heavy doses of opioids for her pain. And so she was coming to us heavily sedated on opioids and still had pain level of 5 or 6 out of 10. 10 is you can't speak, you can't think, you want to kill yourself, and 1 is no big deal. So she was halfway, completely comatose almost, and still had pain of 5. So you can imagine what this woman had to live with. And she's a doctor. So she's unable to treat patients. She's almost bedfast. She can't do anything. Her life is completely upside down from when she got Guillain-Barré. And she was told that she's had to live with it. There's no way around it. She'd have to take medication for the rest of her life because there's nothing they could do for the pain in her upper thoracic region. So up by her scapula, and for those of you who are not familiar with that, that's up by your angel bones. So I said, okay, I don't know if we can help you or not, but let's give it a try because I know I'm not going to hurt you. So let's give it a try. So we had a group of doctors watching and asking questions as we were doing this, and so the first thing we did is we followed the system, and we tested to see if she was in balance, and of course she was not. So the first thing that we had to do is basically put her in balance, and then once we put her in balance, we had to find out where the signals are coming from. Where's that signal coming from that's causing the pain in the back? So we start right on the scapula where she said it hurt, took another electrode and put it down on her leg, turned the power up to a designated level, and she felt very little. And I told her that, just like I tell every single patient, is where the problem ended, not where it's coming from. And if you work on where it ended, you're only going to prolong the problem. If you work on where it's coming from, you're going to get rid of the problem. So in this case, we began to scan her body and got down into her lower hip area, down into her outside of her thighs, and that's where we found the hot spots. And so as I explained to her, the signal is coming from here. And I said, now, tell me, after you got Guillain-Barré, Guillain-Barré doesn't typically do what you're exhibiting, so tell me what happened. Well, after I got Guillain-Barré, I was in an automobile accident. I said, well, tell me what happened. Well, this car went airborne and hit my car head on, and it shook me. I was holding the steering wheel, and it shook me to the right, to the left, and then my head went flying backwards and then flying forwards. I said, all right. And ever since that point in time, you've had this serious searing pain in your back. And she said, yeah. And I said, all right, so what movement bothers you the most? Well, she said, all movements bother me. And I said, well, if you could pick out one, what would it be? What's the most repetitive thing that you did in the past that bothers you now? And she's a horsewoman. So, she said, well, cleaning stables. I said, all right, so how do you clean a stable? Let me see how you clean a stable. And the reason I asked that question is because I want to see, is there a compensation pattern, or is there a pattern for using the muscles in an improper position? And she stood up, and she pretended like she had a shovel, and her legs were completely locked back. Her body was bent over forward, and she was shoveling to the left and then to the right. Now, keep in mind, I have the electrodes on the left and the right of her hip. Her hip does not bother her. Her thoracic region kills her. So I explained to her, I said, how often do you do this? She said, well, I would do this, every day, for hours, clean the stalls out for the horses. And I said, all right. Did anything else bother you? Well, I can't adjust anymore. I can't work on a patient anymore because I have to bend over and move almost in the same position. And I said, all right, so show me how you do that. And so she showed me she did that. So then in the treatment phase, the first thing I had to do is break that pattern. Because everyone listening, whether you're a doctor or whether you're a potential patient, everyone listening to this show today, no matter where you're at in the world, you've been told that if you're going to lift something from the ground, to bend your knees to take the pressure off your back. And everybody says and does the same thing. So I want you to picture this picture. As a matter of fact, if you want to, just stand up, bend your knees forward and bend your back over just like you would pick something up. Now stand up straight. Okay. Now, when you bent over and you bent your knees went forward. So the force went to two specific spots, the middle of your knee and the middle of your back. That's just pure, simple physics. What we need to be told is this. There's a missing piece to that instruction. And that piece is when you are going to pick something up heavy, push your butt to the rear as far as you can, bend your knees, and bend over. Now your knees are not forward of your ankles. Your force is not in your back or your knees. It is now in your hamstrings and your glutes. The minute I put the electrodes on her and began to have her move in that position that she should have been moving in all along, the pain in her back went away instantly. Instantly. So I explained to her the reason that she needed to go through neurotherapy is because every single day we're going to retrain those muscles that she's trained to move correctly. Or pardon me, she's trained them to move incorrectly. We need to train them to move correctly. And I demonstrated to her when she does that movement correctly, and she's being stimulated with the neurotherapy, that it will not hurt. The trouble is that is a neural pattern, and she cannot do it on her own. Because when she fatigues, she's going to go to her old pattern, and the muscles, just quite frankly, aren't going to stay where I have them in the therapy. They're going to last probably an hour and a half, maybe 2 hours at the most after the first treatment. So we tell every patient, look, there's only one way you're ever going to know if we're going to be able to help you, and that's to go through a session. And if we take away all the cost, all the obligation, why in the world wouldn't you do it? And so once you go through the session, you think you're cured. You're not. It's not a panacea. It's not magic. It's a system. And so after that first treatment, we've taken your muscles from being in a contracted ball to lengthened out like we had you do with your arm earlier today. We had you contract your arm into a very tight bicep curl position, and then we had you extend your arm, and it immediately took the pressure off. Well, if your arm has been in that position for 6 months, 6 years, 60 years, you're not going to straighten it out anytime soon. So you have to retrain those muscles. So as I explained to her, in about an hour and a half to 2 hours, those muscles are going to tighten up again, and her pain's going to go back up to around a 3 or a 4. It won't go up to a 5, even with the medication. And without the medication, it would probably be around an 8. So the next day, that period of time will go for maybe 3 hours. Then the next day, 5 hours. And the next day, 7 hours. And the next day, 10 hours. So what we're doing is we're neurologically re-educating that muscle to stay and operate in the proper mechanical positions that it needs to do to keep her out of pain. She went from a pain level of 5 to a pain level of 0 just by moving correctly and having the muscles stimulated to do what they're supposed to do, which is absorb force in the proper position. I know this sounds too easy. I know this sounds too good to be true, but the only way you're ever going to know if we can help you is to try it. And if we've taken all the cost and all the obligation away, we have doctors waiting right now to help you. Right now. And if you're a doctor, we have patients waiting for you right now to help them. So please listen carefully to how you can try the ARP Wave System neurotherapy. Until next week, I'm your host, Denis Thompson. Have a pain-free day.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.